Okay, so now we are going to discuss the management. So under management, we're basically going to look at two aspects. We're going to begin by discussing the medical management, then we're going to conclude by discussing the nursing management. So under the medical management, we're going to begin with our aims. So our aims, we have basically quite a number. So in today's discussion, we're going to highlight number one aim is to control the spasm, number two to promote quick recovery, then three, we have to prevent complications. So we're now going to go at the next aspect, which is drugs or treatment. So under drugs, we're basically going to give three drugs. Namely, we are going to administer tetanus toxoid and tetanus immunoglobulin. We're also going to give benzyl penicillin. We are also going to administer diazepam. So we're going to begin with outlining our first drug, which is tetanus toxoid and tetanus immunoglobulin. So we're going to ensure that we give a standard dose, which is a single dose 0.5 ml intramuscularly. Then action, this is basically used to initiate immunoprocess and neutralize toxins. We're also going to outline the side effects. So there's basically pain on the injection site and fever. Then our nursing implications, you can basically give paracetamol when fever goes above 38 degrees Celsius. Next, we're going to administer benzyl penicillin. So basically under benzyl penicillin, we're going to start with a dose. So under dose, ensure that you give 15 milligrams per kg body weight 4 times daily for 7 days intravenous. Then the action, it's a bactericidal. Basically, it interferes with synthesis of the bacterial cell wall. So it will help to control proliferation of vegetative forms of tetanus organisms at the site. The side effects, we have sensitivity reaction. Basically, there is also fever, anaphylactic shock, and joint pains. The nursing implications include give a test dose of about 0.05 ml intradermal to observe for any signs of anaphylactic reaction. Then we can also give diazepam. So under diazepam, we are basically giving a dose of 1 milligrams per kg body weight. So the action, it relaxes the muscles by acting on the central nervous system. The side effects, there's sedation. Nursing implications, we have monitor the respirations half hourly. Then other drugs that you can administer, there is phenobarbital or even Pavlon. Then we're now going to look at the next segment, which is the nursing management. So under nursing management, let me give you a quick outline. So you can basically follow the Profinema outline either way. So we're going to begin with the environment. Then we're also going to ensure there is position and airway as our second point. Then preventing of spread of infection, observation, psychological care, rest and sleep, medication, nutrition and fluids, hygiene and elimination. So we're going to go back to environment. So under environment, you're basically going to ensure that this patient is isolated to prevent the spread of infections. You're also going to minimize number of visitors. Then the patient should also use his own fomites and other utensils. The environment should be well lit and ventilated. Then the air or the room should be humidified to prevent inspired air from irritating the respiratory tract. Then our second point, which was position and airway clearance. So you as a nurse, you're going to ensure that the patient is basically positioned in an upright position to facilitate breathing. Then you can also at least put a backrest supported with pillows for the patient to relax and also relieve pressure on the back. Then our third point, which was prevention of spread of infection, ensure that you advise the patient to cover the nose and mouth with tissue when coughing, then sneezing, and also doing other things that might lead to droplets of the respiratory discharge. Then you can also advise the patient to always use a sputum mag to spit in. Then advise the patient to be washing hands frequently. Then you can also include observation as your fourth point, psychological care, rest and sleep. So under rest and sleep, maintain a quiet environment to reduce spasmic episodes. Then maintain dim lights, but ensure that there is enough observation to prevent any form of injury as you are carrying out your nursing activities. Then you can also outline the medication, the nutrition and fluids, and also the hygiene aspect. Then you can also include the elimination aspect. So under elimination, we are saying monitor the urine output to rule out urinary failure, monitor bowel movements by checking number of bowel opening to rule out constipation, and also ensure that the bed is clean and comfortable. So there are many ways of coming up with a nursing care plan. I'm not saying this is like the only standard way. And please remember that every content being discussed on this platform is not for medical purposes or medical advice, diagnosis, or even any form of nursing advice. This is only for academic purposes. So thank you for taking your time to listen through, and have a blessed day.